Hi to everyone. I am Dr. Rana Pratap Maurya from Department of Orthodontics, Dental Sciences, Banasi Das University, Lucknow. I will discuss today the topic development of normal occlusion from birth to 12 years of age. First of all, I will discuss about what is the occlusion. The term occlusion is derived from the Latin word that is occlusio and defined as the relationship between all the components of masticated system in normal functions, dysfunctions, and parafunctions. The components of masticated systems include alveolar process, teeth, jaw bones, temporomandibular joints, and muscles, ligament attached to this joint. So normal occlusion is centered around occlusal contacts, alignment of teeth, overbite, and overgen, and also the arrangement and relationship of the teeth within the arch and between the arch, and also the relationship of teeth to osseous structures, that is bones and PM joints. Then definitions of occlusion. The various definitions are given for the occlusion. The angle defined the normal relationship of the occlusal inclined planes of the teeth when the jaws are closed. And Ramford and S defined the medium that bring all the branches of dentistry together. Because the goal of all the branches of dentistry is to achieve a normal or good occlusion. And according to Dorland Medical Dictionary, the act of closure or process of being closed. Then development of occlusion. It is genetically and environmentally conditioned process, which means the occlusion is influenced by the genetics because gene determines the jaw size, development of maxilla and mandible, shape and size of tooth, and the environmental conditions, which may include the local environmental conditions and general environmental conditions, like deciduous tooth which are retained beyond the normal time, carriers of deciduous dentitions, and various habits, they also affect the development of normal occlusion. And this development of occlusion, it varies individual to individual. So the for development of an acceptable occlusion, there are coordination of different events is necessary. In development of normal occlusion, the various events takes place like eruption of molars, exchange of incisors, eruption of canines. So if there is any disturbance or failure in one part of the developmental process, it may lead to anomalies, else may be compensated by the other developmental factors. So there are various periods of occlusal development, which is divided into mainly 4 periods: pre-dental periods, deciduous dentition periods, mixed dentition periods, permanent dentition periods. So the pre-dental periods start from birth to eruption of deciduous first tooth in the oral cavity. The first deciduous teeth generally erupts is mandibular central incisor, sometimes in maxillary central incisor. So at the time of birth, the alveolar dental arches, it is called as gum pads. In maxilla, it is horseshoe shaped, and in mandible in U shape. Though the gum pads, these are pink in color and firm in consistency, and they are covered by a dense layer of periosteum. And each gum pads develops into 2 parts, that is labial portions differentiated first and lingual portions differentiated later. Labial portions differentiated first because it contains the tooth bud of deciduous dentition, and lingual portions which contains the tooth buds of permanent dentition. So features of gum pads, the labial and lingual portions in diagram, we can see that they are separated from each other by the dental groove. The dental groove is the site of origin of dental lamina. So the labial portions which contain tooth buds of deciduous dentition and lingual portion contains the tooth bud of permanent dentition. In diagram, we can see the dental groove. And each transverse gum pads, they are divided into segments by the transverse groove. Each segment, they contain the tooth buds of deciduous dentition. So, since there are 10 tooth in each arch, so there are 10 segments into the each maxillary and mandibular dental arches. And groove between the deciduous canine and first molars, these are more prominent. So it is called as lateral sulci. Then upper gum pads, gingival groove, it separates the gum pads from the palates, and dental groove, it originates from the incisive papilla region and extends backward to touch the gingival groove in the canine region and then laterally to end in the molar region. Because after the second deciduous molars, there is no primary teeth. So there is no dental groove because dental groove separates the labial and lingual portions which contain the tooth buds of deciduous and permanent dentition respectively. Lower gum pads, and in lower gum pads, anterior portions are everted. And gingival groove, it separates, it demarcates the lingual extents of gum pads. And dental groove, it runs from the midline backward to join the gingival groove in the canine region. And it also ends to the second molar region. Then the relationship of gum pads. Kleins found that there are vertical spaces which is found between the upper and lower gum pads in the incisor region at birth. So maxillary gum pad, it is larger anteroposteriorly as well as in transverse direction than the mandibular, and in occlusion overlaps in front as well as in the sides, just like in the arrangement of the permanent, where also occurs the positive overjet in anterior as well as in posterior. So in occlusal, the context occurs only in the first molar region at birth, and a space exists between them anteriorly, which is called as infantile open bite. So this infantile open bite, it is considered normal and it helps in suckling for the babies. At rest, the gum pads are separated by the tongue lying over the lower gum pads. So during functions, the mandibular movement at this gum pad stage, they are mainly in vertical direction, and there is a very small extent in anterior-posterior directions, and lateral movements, these are absent. At birth, lower jaw is often situated posteriorly, and this relationship has clinical significance because the retrognathic mandible, if there occurs any postnatal disturbances in the forward growth of the mandible, then it may lead into the development of malocclusion. Means there develops class 2 malocclusion. And also the infantile open bites, it will convert it into the mature swallow after the eruption of permanent incisors. Growth of gum pads. At birth, the width of gum pads, they are inadequate to accommodate all the incisors. So the growth of the gum pads is rapid in the first year after the birth, where occurs development of the gum pad, deciduous dentitions, and eruption of the deciduous. And growth is more in transverse directions than in labiolingual direction. And due to growth, the segments of each gum pads it become prominent because of due to eruptions of the uh, deciduous and eruption of deciduous teeth. It commences at around 6 months of age, generally mandibular incisors, central incisors, and sometimes in maxillary incisors. There are some precautiously erupted. So sometimes an infant may be born with teeth that are called precautiously erupted. Natal teeth, the teeth which are present since birth, and neonatal teeth, it erupts during the neonatal period. It extends from the birth to 30 days of postnatal life. And premature teeth, the teeth which erupts before the first three months of postnatal life. So there is some incidence for this precociously erupted tooth. Generally, natal and neonatal teeth, the ratio of 1 to 1,000 to 1 to 30,000. And among 80% of the natal and neonatal teeth, they are generally deciduous mandibular incisors. And then after that, maxillary incisors, which are 11%, then 3% of mandibular molars and cuspids, and minimum incidence is for the maxillary molars and cuspid, which are 1%. The deciduous dentition periods, the general characteristics of deciduous dentition period is both the dental arches are half round or wide in shape, and almost no curve of spine in deciduous dentition periods. And there occurs the shallow cuspal interdistation and shallow overjet and overbite. And there is vertical inclination of incisors, means they are more upright, and little or no crowding in deciduous dentition periods. And the molar relationships are in straight or in flush terminal plane relationship. That means the distal surface of second deciduous molar in upper and lower arch lie in one plane. Spacing, Delabere was the first to describe the interproximal spacing in deciduous dentition. And Baum, he concluded that there is no physiological spacing after the eruption of primary teeth, and he emphasized that one has either a spaced dentition or a closed dentition. Spaced dentition, the spaced dentition in deciduous dentition, they are supposed to be a good sign for the development of normal occlusion. Because spaces in between the dentition, it can be utilized for the adjustment of eruption of permanent successors. Because the mesodistal width of erupting incisors, they are more as compared to the deciduous dentition. So these spaces are utilized for the adjustment of erupting permanent. And the spaces which are present, there are two types. One is primate space and other is physiological or developmental space. First, primate space, or it is also called as anthropoid space or simian spaces. It is very prominent space in the primate species, so it is called as primate space. It exists in human between the upper lateral incisors and canines, and in lower arch between the canines and deciduous first. So the primate space, it occurs mesial to deciduous canine, and in mandibular arch occurs distal to the deciduous canine. And second is physiological spacing or developmental space. It is present in between the primary teeth as in shown in figure, and it play an important role in the normal development of permanent dentition. The total spaces present, it may vary in the maxillary arch from 0 to 8 millimeter and average is 4 millimeter, and in mandibular arch it varies from 1 to 7 millimeter with average of 3 millimeters. And second is non-space dentition. It is also called as closed dentition. So in this, there is no spaces present in the primary dentition. And lack of space, it may be due to either narrowness of dental arches or teeth which are more wide as usual. So at the age of 6 years, a gap tooth smile is not is preferred, not a Hollywood smile is preferred. Hollywood smile means uh, without spacing. Okay? There is no interproximal spacing, interdental spacing. So if there occurs a non-space dentition or if a minor clouding occurs in deciduous dentition, it is a not good sign for development of normal occlusion. It usually indicates crowding in developing permanent dentition. Second is molar relationships. There are three types of molar relationships in the deciduous dentition. First is straight or flush terminal plane, and mesial step or distal step. So straight or flush terminal plane, there is a normal relationship of primary molar. It is most common occurrence. Okay? In this, the distal surface of upper as well as lower second deciduous molars, they occurs in a one vertical plane. So it is called as straight terminal plane as seen in diagram. This is straight or flush terminal plane. Here you can also see the straight or flush terminal. Second is mesial step. It is equivalent to Engel's class 1 mala. Because in Engel's class 1 mala occlusion, there is a mesial relationship of lower molars as compared to the maxillary molars. In this, the distal surface of lower second molars is more mesial as compared to the distal surface of upper molar. So there is formation of step which is in mesial direction. So it is called as mesial steps. Next is distal step. It is equivalent to class 2 malocclusion. Because in class 2 malocclusion, the lower molars are more distal as compared to the upper molars. So in this distal step, the distal surface of lower second deciduous molar is more distal than the upper second deciduous molar. So there is a formation of a distal step. Eruption sequence of deciduous dentition. First, lower mandibular second incisor erupts at around of 6 to 10 months. Lateral 10 to 16 months. Canine 17 to 23 months. First molars 14 to 18 months and second 23 to 30 months. And in upper arch, central incisors 8 to 12 months, lateral incisor 9 to 13 months, canine 16 to 22 months, and first deciduous molar 13 to 19 months, and second deciduous molar 25 to 30. So we can see that this in lower arch, the counter part as compared to the maxillary arch, it erupts first as compared to its counterparts in the upper. Mixed dentition period. It contains both deciduous as well as permanent dentition. It extends from 6 to 12 months. So mixed dentition period, it is divided into three periods. First, transitional period, intertransitional period, and second transitional period. The diagram shows the mixed dentition periods. It contains both permanent as well as a deciduous dentition. So it is called as mixed dentition. So first term transitional periods, in this period, two events take place. One is eruption of the first permanent molar and transition of incisors, means exchange of deciduous incisor to the permanent incisors. Eruption of first permanent molar. The first permanent molar erupts at the age of 6 years, generally first mandibular molars. So it eruption of first permanent molars it play an important role in establishing and functioning of occlusion in the permanent dentition. It determines the type of malakum. Means it may be class 1, class 2 or class 3. So anterior-posterior positioning of the permanent molars, it is influenced by the three factors. One is terminal plane relationship. It is either flush terminal plane, mesial step or distal step. And early major shifts of molars by utilizing a primate space and differential growth of maxilla and mandible. These three factors determine the anterior-posterior positioning of the permanent molars. Terminal plane relationships. When deciduous second molars are in flush terminal plane, means the distal surface of upper and lower first second molars, they are in one plane. So the permanent first molars, they initially erupts into cusp to cusp or end to end relationship, which later transform into class 1 molar relationship by using either primate space or leeway space. When it utilizes primate space, it is called as mesial shift. And when it utilizes the leeway space of Nance, it is called as late mesial shift because the molars shift late. When deciduous second molars are in distal state, the permanent first molar will erupt into class 2 relationship. This molar relationship is not self-correcting and will cause development of class 2 mal. And when deciduous second molars are in a mesial state, the permanent first molar, it will erupt into the class 1 relationship. This may remain or progress to half or full class 3 malacular, depending upon all three factors which we have discussed. Previously, we have discussed these three factors. Early mesial shift, it occurs when there occurs a physiological space in deciduous dentition. In diagram, we can see there is primate space or physiological spacing. So, erupting first permanent, apply a eruptive force of permanent molars. It causing closing of spaces between the incisors or closing of spaces of primate space, thus allowing the molar to shift in mesial directions. So there occurs correction of end on molar relationship to the class 1 molar relationship. In diagram, this arrow indicates the primate space or physiological spacing. So this erupting molar, it applies force and it shifts into the mesial direction. Because it correct early, so it is called as mesial shift. Then late mesial shift, it occurs in closed dentition where no physiological spacing is. In this, the permanent first molar shifts mesially after exfoliation of the deciduous molar by utilizing leeway space of plane. Means the first permanent molar, here in diagram you can see, they initially erupt into end-on relationship. And after exfoliation of deciduous canine, first molar and second molar, it utilizes the leeway space of Nance, okay, which causes shifting of molars in mesial direction. Since it occurs late, so it is called as late mesial shift. So leeway space of Nance. It is the combined mesiodistal width of deciduous canine, first molar and second molars is more as compared to the combined mesiodistal width of the permanent canine, first molar and second. So in diagram, we can see that the mesiodistal width of deciduous canine, first, second molar is more as compared to the permanent canine, first and second premolar. So the difference in between two is called the leeway space of Nance. It is more in mandible, that is 1.7 millimeter per side, total 3.5 millimeter, 4 millimeter, and in maxilla 0.9 millimeter per side, totally 1.8 millimeter. These are occlusal relationship of primary and permanent molar. So distal steps, it may change into the class 2 end-on relationship by using minimal growth difference, forward growth of mandible and shift of teeth. Plus terminal plane, it may change into the end on, class 1 and class 3. And mesial step change into the class 1 and class 3. So all these utilize the red arrow indicate the growth differentials, and breakage arrow indicates the forward growth of mandible, and dark arrow indicates the shift of the tip. Eruption of incisors. The permanent incisors, it develops lingual to the primary incisors. And for the incisors to erupt in normal alignment, there is an obligate space requirement in the anterior part of both arches, which is termed as incisor liability. Because the mesodistal width of the erupting permanent incisors is more as compared to the deciduous incisors. So there requires a space for the normal alignment of erupting permanent incisors. So the incisor liability is the difference of the sum of mesodistal width of permanent incisors minus sum of mesodistal width of the deciduous incisors. In maxilla, it is generally shown to 0.6 millimeter, and in mandible 6 millimeter. So this obligate space, that is incisor liability, it is provided by 4 means. One is physiological spacing in primary dentition, which is in maxillary arch it is 4 millimeter, and in mandibular arch it is 3 millimeter. And increase in the intercanine arch width, which causes increase in arch perimeter, and increase the anterior length of the dental arches due to the growth, and also change in the inclination of incisors from 150 degree to permanent incisor. We have discussed that the in deciduous dentition, the incisors are more upright. So when it change inclination from 150 degree to 123 degree, it also give a space for alignment of incisors. So, ugly duckling stage, it is also called as broadband phenomenon. See, ugly duckling stage is transient or self-correcting malocclusion. Means it corrected by itself. It occurs during the eruption of the permanent canines in maxillary arch. Because in maxillary arch, the permanent canines, it erupts late as compared to the first and second premolars. So it is seen in maxillary incisors regions as a midline diastema between 8 to 10 years of age. In diagram, we can see there is a midline diastema and flaring up incisor. And also in OPG, we can see there is a spacing between the central incisors. It occurs due to eruption of the canine. In OPG, you can see that canines are erupting. So it occurs because in diagram you can see the crown of erupting canine, it impinges on the roots of developing lateral incisor roots, then causing the crowns to flare laterally. Second diagram. And roots of the maxillary central incisors, it is also forced together by lateral incisors, thus creating a midline diastema. So with eruption of canines, the impingement of from the roots shift incisally from apically to incisally. So it apply pressure over the crowns of the lateral incisors, and it transfer to the crowns of central incisors, thus causing the closure of the midline diastema. Okay. So it will be corrected after the eruption of permanent canine. So it is called a self-correcting malocclusion. There are various self-correcting malocclusion in gum pads, retrognathic mandible, corrected by differential and forward growth of the mandible, anterior open bite, corrected by eruption of primary incisors, infantile swallow, corrected by weaning of the liquid to solid foods. In primary dentition, anterior open bite, it corrected by eruption of primary molars, adhesion of incisal edges, changes in incisal angulation and forward and downward growth of the mandible, and straight terminal planes by early mesial shift, primary spacing corrected by eruption of permanent teeth, and mixed dentition, mandibular anterior crowding corrected by physiological spacing, intercanine width increase, tongue pressures, and ugly duckling stage corrected by maxillary canine eruptions, end on relationship of first permanent molar corrected by late major shift, and in permanent dentition over and over jet and overbite corrected by eruption of all permanent teeth and differential growth of the mandibles. Intertransitional period, it is most stable phase. In this period, there is very little or no changes. So teeth present, these are the permanent incisors and first molars along with the deciduous canine and molars. The features in intertransitional period is any symmetry in emergence and corresponding difference in the crown length between the right and left side teeth are made up. Occlusal and interproximal wear of deciduous teeth causes occlusal morphology to approach that of a plain, ugly duckling stage. Root formation of emerged incisors, canines, and molars continue along with the concomitant increase in the alveolar process height. Reabsorption of roots of the deciduous molars. Second transition period, the following event takes place: exfoliation of primary molars and canines, eruption of permanent canine and premolars, eruption of permanent second molars, and establishment of normal. First, exfoliation of primary molars and canine. It occurs around 10 years of age. Deciduous molars, mandibular canine sets. So usually no crowding is seen before the emergence except maybe between the maxillary first premolar and canine. Second, eruption of permanent canines and premolars. The first posterior teeth to erupt are mandibular canine and first molar, that is at 9 to 10 years, followed by maxillary premolars and canine, that is 11 to 12 years. The common sequence of eruption is in maxilla 4 means first premolar, second premolar, and then canine, and mandibular canine, first premolar, second. So favorable occlusion in this region is largely dependent on the tooth size, available space ratio. Before emergence of second molars, they are oriented in the mesial and in luminal direction. In diagram, we can see that the second molars, they are oriented in mesial and in luminal directions. So these teeth, they are formed palatally and are guided into occlusion by the cone funnel mechanism. Means the upper palatal cusp, here the upper palatal cusp, it acts as a cone which slides into the occlusal fossa which acts as a funnel. Next is eruption of permanent second molars. So before emergence, second molars are oriented in a mesial and lingual directions. So these teeth are formed palatally and are guided into occlusal by the cone funnel mechanism. That is, upper palatal cusp as a cone slides into occlusion fossa of the lower molar sagittal. And arch length is reduced prior to the second molar eruption by the mesial eruptive force. Therefore, crowding if present, it is accentuated in this time. Then next is establishment of normal occlusion. There is proper intercuspation, proper cusp fossa relationship, proper cusp impression relationship, normal overjet, normal overbite. This is a eruption sequence of permanent dentition in upper, first molars, central incisor, lateral incisors, then first premolar, second premolar, canine, then second. And in lower arch also, the first molar, central incisor, lateral incisor, canine, first premolar, second premolar, then second. Thank you. I hope that you have understand about the development of normal occlusion from birth to 12 years. Thank you.